The hip joint is a large ball and socket joint. The top end of the femur, the thigh bone, is shaped like a ball, and this ball fits into the socket in the pelvis. Because the hip joint is a ball and socket joint, it has a diverse range of movement. Let's explore this range of movement now. We can flex the hip forwards, and we can extend it backwards. Generally, when we move two bones closer together, we call that flexing, and when we move them further apart, we call that extending. So in this case, when we move the leg forward, we're flexing the hip. When we move the leg back, we're extending the hip. Try standing on one leg and flexing your hip and extending it. See what your range of movement is like in this direction. Try it on both legs and see if there is any difference in your ability to flex and extend your hip on each side. You can try this on a regular basis to check to see if your range of movement is improving with your yoga practice. We can also abduct our hip by moving our leg out away from our body, away from the midline. Practice doing this now with both legs. Again, checking to see if you have any imbalances in your ability to abduct your hip on both sides. We can also adduct our hips by moving our leg towards the midline. So to abduct our hip is to move our leg away from the midline, and to adduct our hip is to move our leg towards the midline. Try standing on one leg and moving your leg towards the midline. Try it with both legs, and again look out for any imbalances you may have between your hips. Again, you can try abducting and adducting your hips on a regular basis to see if you're making any progress with your range of movement through your yoga practice. We can also internally and externally rotate our hips. First of all, try internally rotating your hips by turning your feet inwards. You should be able to turn your feet to at least 45 degrees. And again, look out for any imbalances you may have between your hips. Now try externally rotating your hips by turning your feet out. Again, you should be able to rotate your hips so that your feet are turned out to at least 45 degrees. The knee joint is a hinge joint and has a much more limited range of movement than the hip. The knee joint can flex when you bend your knee and extend when you straighten your knee. Try flexing and extending both of your knees to check your range of movement. Check to see if you feel any pain or discomfort at any time when flexing or extending your knee. Check that you're able to do so in a smooth and fluid manner. Again, check to see if there are any imbalances between your knees. The health of our hips and of our knees is intimately connected. All the movements of the hips and their associated muscles have a direct impact on our knees. If our hip muscles are tight or weak or both, this can affect the alignment of the knee at rest and in movement. Knee pain can actually result from a problem in the hip. This is called referred pain. Yoga is often associated with stretching, but it is as much about strength. For our muscles and our joints to be healthy, we need a careful balance between flexibility and strength. It is as detrimental to overstretch a weak muscle as it is to neglect a short, tight one. The best approach for hip and knee health is a balance between flexibility and strength. In yoga, you will often hear talk of hip openers. Hip flexibility is important, but is equally important to build muscle strength. Weak hip muscles can reflect negatively down to the knee, and this is compounded when inner thigh muscles aren't strong, which is common. Let's have a look at some examples of how our hip movements and hip muscles can affect the knee. The glutamus maximus is the largest muscle in the body. One of its main jobs is to help the thigh bone rotate externally. Try it now. Place your hand over your bottom and externally rotate your leg, and feel the action of the glutamus maximus working. If the glutamus maximus is weak, the thigh bone can end up overly turning in, and this puts pressure on the inner knee, which can cause inner knee pain and injuries. The iliopsoas is a deep muscle which connects the thigh to the spine. It is one of our major hip flexor muscles, but it also, along with the glutamus maximus, prevents excessive inward rotation of the thigh. So having a weak or tight iliopsoas can also cause problems at the inner knee. You can feel your iliopsoas muscle working by placing 2 fingers at the hip joint and flexing your hip. Try it now. The iliopsoas needs to be long and strong to support a healthy and durable knee joint. It is often weak in people with knee pain. Our rectus femoris is our other main hip flexor and is the biggest of our quadricep muscles in the front of our thighs. You can feel the rectus femoris working by placing your hand on the front of your thigh and flexing your hip. Try it now. If the rectus femoris has to work overtime to make up for a weak iliopsoas, it has the ability to overpower the knee and push it back into hyperextension. The other way that the rectus femoris can affect the knee is if the rectus femoris, the biggest quadricep, is much stronger than the inner quadricep, which is called the vastus medialis. This can pull the kneecap out of line. It is quite common to have a rectus femoris that is a lot stronger than a vastus medialis, and it is a common cause of knee pain. You can feel the vastus medialis by placing 2 fingers about 1 inch to 2 inches above the inside of the knee. Extend the knee and you should feel the vastus medialis engage. A weak glutamus maximus also puts extra work on the hamstrings, which are the muscles at the back of your thigh. This causes the hamstrings to become tight, and this can also put further pressure on the knee. Tight hip flexor muscles, especially combined with a weak glutamus maximus, can pull the pelvis forward into an anterior tilt. This causes the thigh bones to internally rotate and causes further pressure on the inner knee. The Thomas test is a test that you can use to see if you have tight hip flexor muscles. Remember that your two main hip flexor muscles are your iliopsoas and your rectus femoris. Let's take a look at how you can perform the Thomas test at home. Lay on a table with the back of your knee against the edge of the table and your lower legs hanging down. Now hug one knee into your chest, leaving the other leg dangling. If, when you hug your knee into your chest, the lower thigh of the other leg remains on the table, your iliopsoas muscle is of normal length. If, however, your lower thigh raises off of the table, you have a short or tight iliopsoas muscle. If, when you hug your knee into your chest, your lower leg stays at right angles with your upper leg, then you have a rectus femoris of normal length. If, however, when you hug your knee in, your lower leg extends out, this means that you have a tight or short rectus femoris muscle. If your thigh raises up off of the table and your lower leg extends out, then you have a tight rectus femoris muscle and a tight iliopsoas. The tensor fasciae lata is a long muscle that runs down the outside of your thigh all the way from your hip to your tibia. Its basic functional movement is in walking, but it's also a hip abductor muscle and is used to internally rotate the thigh bone. If you place your hand on the outside of your thigh and abduct your hip and internally rotate your thigh, you can feel the tensor fasciae lata muscle. Because it's used in many movements and is shortened while sitting, it can easily become tight. When the tensor fasciae lata muscle is tight, it can cause pelvic imbalances, hip pain, lower back pain, and pain in the outside of the knees. The adductor muscles are fan-like muscles on the inside of the thigh that help to pull the legs together when they contract. They also help to stabilize the hip joint. If you stand in mountain pose with your feet hip distance apart and place your hands on the inside of your thighs, and then bring your feet completely together, then you'll be able to feel the adductor muscles engaging. It is common to have weak and/or tight adductor muscles, because unless you engage in activities such as horse riding, it's not a muscle group that we use a great deal. Sitting cross-legged also tightens the adductor muscles, and as we tend to sit with one leg crossed more often than the other, it creates an imbalance in the adductor muscles. Tightness or weakness in the adductor muscles can lead to ankle, knee, hip, and low back pain. Practicing yoga is a good way to increase strength and flexibility in the muscles we've been talking about. And also, it's a good way to create balance in the body. So let's have a look at some asanas that are really good for hip and knee health.